One morning, you wake up and can't recognize your loved ones. Your memories slip away like sand through your fingers, or your hands tremble uncontrollably, turning every simple task into a battle. Over 10 million people worldwide suffer from the most common neurodegenerative diseases, Parkinson's and dementia, and right now, there's no cure. People everywhere are searching for alternative treatments for these brain disorders, but there's a mysterious mushroom, largely unknown to many, that might just change everything. This video dives into a valuable solution for Parkinson's and dementia, so stay with us for an eye-opening journey. What are neurodegenerative diseases? Parkinson's and dementia, including Alzheimer's, are conditions that slowly and silently destroy parts of your nervous system, especially areas of your brain. Dementia's Jungian here, their building anyone have people strategy, their form, and their Vardo, about 1 million people in America alone are affected by Parkinson's disease. Experts have identified many causes and risk factors, including age, genetics, environmental exposures, habits, and lifestyle choices. The progressive loss of neurons, the brain cells essential for communication, disrupts key functions: mood, depression, anxiety, apathy, cognition, memory loss, confusion, difficulty thinking, motor function, tremors, stiffness, slower movement, lack of coordination. Because these diseases target specific brain regions, their symptoms worsen over time, dramatically impacting quality of life. But what if the key to unlocking brain repair lies not in conventional drugs, but in psychedelics? Don't miss this crucial insight. Psilocybin is a psychedelic compound found in hundreds of types of mushrooms. This quote-unquote magical mushroom starts working about 20 minutes after consumption, with effects lasting roughly 6 hours. What's fascinating is that some people experience long-lasting benefits from psilocybin therapy, weeks or even months later. South American Aztec Indians revered psilocybin in religious and healing rituals. It was first scientifically identified in 1950 and is now gaining popularity amid a modern scientific and medical revival. In the next few minutes, you'll learn exactly how this magic mushroom helps patients with Parkinson's and dementia reclaim their lives. How does psilocybin help? Neurodegenerative benefits. 1. Promotes neuroplasticity, brain's ability to heal and rewire. One of psilocybin's most powerful effects is its ability to increase neuroplasticity, which means a boost in the brain's capability to grow new neurons and rebuild connections. Think of your brain like a city's road system. In neurodegenerative diseases, many roads are damaged or blocked, impairing communication between neurons. Psilocybin acts like a construction, repairing and creating new roads so messages can flow freely again. This process includes increased dendritic growth, branch-like structures of neurons, enhanced synaptogenesis, formation of new neuron-to-neuron connections, increased synaptic protein levels, which strengthen those connections. These new neural pathways are critical for improving memory, learning, creativity, cognitive flexibility, and overall brain function. 2. Reduces neuroinflammation, cooling the brain fire. Inflammation in the brain accelerates neuron damage, promoting the progression of Parkinson's and dementia. Psilocybin has anti-inflammatory properties. It calms overactive immune cells called microglia and reduces the production of harmful inflammatory chemicals. This reduction in neuroinflammation helps protect existing neurons and slows degenerative processes. 3. Improves mood and anxiety, lifting the emotional burden. Depression and anxiety are common in Parkinson's and dementia patients, often worsening cognitive decline. Psilocybin has rapid and sustained antidepressant and anxiolytic effects. It lifts mood and reduces anxiety, sometimes with benefits lasting for months. Improved mood leads to better cognitive engagement and social activity, key elements in managing neurodegenerative diseases. 4. Multi-symptom relief, the magic of treating it all. Unlike many standard therapies that tackle only one symptom, psilocybin's effects can simultaneously improve mood, cognition, and motor function. For example, in Parkinson's disease, long known for its physical symptoms, recent research found psilocybin also significantly enhances mood and cognition, which are strong predictors of patients' quality of life. Scientific proof, the latest research. A breakthrough 2025 pilot study at UCSF tested psilocybin therapy on 12 patients with mild to moderate Parkinson's disease. They were given 2 doses, first 10 milligrams, then 25 milligrams 2 weeks later, combined with psychotherapy. The results? Clinically significant improvements in mood, cognition, and motor function reported by patients. Side effects like nausea and anxiety were mild and short lived. Remarkably, benefits for mood and motor symptoms lasted for at least 3 months after treatment. This study is the first to show a psychedelic's safety and efficacy in neurodegenerative disease patients. Researchers explain these benefits may arise because psilocybin lifts mood, enabling patients to become more active, connect socially, and think more clearly, all driving positive physical changes. Understanding psilocybin's benefits for dementia. Psilocybin's potential isn't limited to Parkinson's, it extends to dementia and Alzheimer's disease. Neuroplasticity improvement translates into better memory and emotional regulation. Since anxiety affects nearly 40% of Alzheimer's patients, psilocybin's anxiety reducing effects provide vital relief. Experts at Johns Hopkins University, with over 20 years of psychedelic research, note psilocybin helps cancer patients by dramatically reducing depression and anxiety, suggesting strong relevance to dementia patients who face similar emotional challenges. In dementia, improved mood and reduced anxiety do more than improve feelings. They may slow cognitive decline by alleviating the stress that worsens brain cell damage. One of the most remarkable features of psilocybin therapy is how its benefits persist long after the psychedelic experience ends. Laboratory and clinical studies show that changes in brain plasticity and connectivity start within hours. Structural brain changes in neurons last weeks. Clinical mood and cognitive benefits can endure for months, sometimes over a year. This window allows therapies to trigger brain repair processes lasting far beyond the drug's presence in the body. A word of caution. While these findings inspire hope, it's important to remember, in some countries, psilocybin therapy for Parkinson's and dementia is still experimental. Larger, long-term, multi-site clinical trials are underway to confirm benefits. Psilocybin requires careful medical supervision, not self-medication. Sometimes, the smallest things shine the brightest. A humble mushroom, revered by ancient peoples, is now revealing its power to help repair damaged brains, reduce depression and anxiety, and improve quality of life for millions facing Parkinson's and dementia. If you found this video informative, please subscribe for more insights into the emerging science transforming brain health. Share this message of hope, because knowledge can light the way toward healing. Thank you for watching.